Lesson 42. Treatment of APV disease in chickens. Welcome to the program Dr. Vet come to the livestock world. Recently, APV disease has become relatively common, and when chickens get this disease, people often confuse it with swollen head disease caused by Coryza, and treat it according to the method of treating Coryza disease, but it does not cure. Therefore, today Dr. Vet come to the livestock world will accompany you to learn more about this disease, to have better measures to prevent and treat the disease. About the cause of the disease. APV disease is caused by avian pneumovirus, an RNA virus that causes respiratory disease in chickens of all ages. The disease is transmitted through the respiratory tract and often occurs when stocking density is high and barn management is poor, with high levels of toxic gases in the barn such as an H3, CO2, H2S. The disease has a high infection rate, up to 100%. The mortality rate depends on the underlying pathogen. When infected with APV, chickens are very susceptible to common diseases such as E.Coli, Coryza, typhoid, asthma, C or D. Because these are all bacteria that are readily available in the chicken barn and body. And when chickens get graft disease, the death rate will increase. Therefore, it is necessary to detect and treat promptly based on the symptoms. Symptoms are as follows. Chickens grow slowly, eat less, become moody, and have shabby feathers. Eyes foamy and watery. This is one of the characteristic manifestations of the disease. Chickens have difficulty breathing, breathe rapidly, and have tracheal rales. Chickens have rhinitis and runny nose. Swelling of the head and face, head tremors, scalp edema. This symptom can easily be confused with Coryza disease. Chickens can become paralyzed and have a twisted neck. In severe cases, APV is combined with E.Coli, causing swollen head syndrome. This syndrome occurs in chickens over 1 month old with typical neurological and respiratory symptoms such as chickens have difficulty walking, wringing their necks, shaking their heads, swelling of the head, face and eyes. For laying hens, ovaries are broken, atrophied, deformed, eggshells are thin and pale. The rate decreases by 5 to 30%. For chicken breeds, hatching rate decreases by 5 to 10%. To more accurately diagnose the disease, people need an autopsy to check for lesions. When chickens are infected with APV, they often have the following symptoms: eyelid inflammation, blindness, inflammation, and yellow fibrin layer under the scalp and cheek skin. The trachea had mucus but no bleeding. Chickens with severe APV will have bleeding at the end of the trachea. Laying hens, ovaries are easily damaged, young eggs break easily, causing peritonitis. To prevent disease, you must keep the cage well ventilated, with reasonable density, and periodically clean and disinfect once a week with iodinate or Dexin super according to the manufacturer's instructions. Use biological products or deodorizing minerals, such as Biopharm or Stop Odor, to minimize toxic gases in the barn, helping to minimize respiratory diseases as well as APV disease in chickens. Prevent disease with full vaccination. Use Glucan C or Promulti WS according to the manufacturer's recommended dose to increase resistance and limit stress for chickens. About disease treatment. Because APV is caused by a virus, there is no specific medicine to treat this disease. However, people need to treat the symptoms and use antibiotics to prevent secondary diseases and clean the barns and areas. Livestock sector with antiseptic products that we mentioned in the disease prevention section to destroy pathogens in the environment. To treat disease symptoms, people use the following medications: cough suppressant, expectorant, fever reducer. Using phenicin oral helps reduce cough, expectorate, anti-inflammatory and fever reducing. Or use Brom 20 WS to loosen phlegm and reduce cough. In case the chicken has fever, use Paramol 200 WS to reduce the fever and help the chicken recover quickly. Using antibiotics for secondary prevention. Regimen 1. For mild cases, powdered antibiotics can be used to mix food and water for chickens as follows. Use antibiotics Flo plus Doxy or Doxy plus Tylo. Mix for 3 to 5 days. We only recommend that people use products like Flodex 150 WS or Tylodox WS or Doxy 50 plus Macrolin WS. Regimen 2. In case of seriously ill chickens, inject a pair of Ceftifor Power Plus Gen 5% plus Lincospectin. Or you can inject Ceftifor Power Plus Gen 5% plus Linspectin plus Energy 300. Inject 1 milliliter of mixed solution 3 to 5 kilograms body weight. Inject continuously for 2 to 3 days. Then use regimen 1 for another 2 to 3 consecutive days. Recently, we have shared with you APV disease in chickens and how to prevent and treat it effectively, hoping to bring a lot of useful information to livestock farmers. Thank you for your attention. Hello and see you again.